So good morning, good afternoon, good evening. I can see we've got people online from all over the world, 113 participants. So that's really exciting. So a very, very warm welcome from a very, very cold Johannesburg on this important webinar on menstrual health responses to the COVID-19 pandemic in Africa, really to explore what we've learned since the pandemic started in Africa a couple of months ago. So my name's Justine Coulson. I'm the Deputy Regional Director for UNFPA here in East and Southern Africa. And so under the leadership of UNFPA East and Southern Africa, the African Coalition for Menstrual Health Management and Days for Girls are hosting this important dialogue today to share some of the experiences and emerging lessons learned in responding to menstrual health needs in Africa during the time of COVID-19. So 2 months on from the start of the pandemic, what challenges are people who menstruate facing across the continent when it comes to their management of their menstrual health? And what can we be doing more to address these challenges? So from our discussions today and our continuing interactions with you through the African Coalition for Menstrual Health Management, the core team are going to be developing a guidance note on MHM and pandemics. And so we welcome all of your contributions to this today. So all of your questions and comments will all really help to shape this important guidance note for people working on this issue across the continent. So to kick us off today, I'm very pleased to hand over to Dr. Julita Onabanjo. She's the Acting Deputy Executive Director for UNFPA. Julita.
Thanks, Justine. Good morning, good afternoon, good evening, everyone. And really on behalf of the United Nations Population Fund, UNFPA, the Africa Coalition on Menstrual Health Management, and our dear partner, Days for Girls, a very, very warm welcome to this virtual dialogue on the eve of the 2020 International Menstrual Hygiene Day. I'm so glad that technology has allowed us to connect with you all, and really great to see and to hear that they are participants from across Africa, but also from further afield. And a very special thanks up front to our esteemed panelists. And I see it's Alice's birthday, so happy birthday, Alice. In just 15 weeks since the first case of COVID-19 was reported in Egypt, and 11 weeks since WHO declared COVID a public health pandemic, Africa has recorded over 119,000 cumulative COVID-19 cases and 3,575 COVID-related deaths. And in that same time, the continent's over 400 million women and girls aged 10 to 49 have continued to menstruate. There has been no hiatus or pause moment for periods. In fact, in this unprecedented COVID times, a brighter light has been shone on the difficulties the millions of people who menstruate face when they're managing their periods, trying to be safe, hygienic, confident, and comfortable, and with dignity. UNFPA's Executive Director, Dr. Natalia Kanem, frequently says that the COVID-19 pandemic has been catastrophic for the world and a calamity for women and girls. We call this a crisis within a crisis for women and girls and existing inequalities as we fight to secure and protect in the midst of this pandemic the human rights, including the sexual and reproductive health and rights of all people. Access and choices to essential quality and integrated sexual and reproductive health and menstrual health information, education, products and services are being set aside or simply just ignored in the many national COVID-related responses and recovery efforts. And the theme of this year's Menstrual Hygiene Day, #It's Time for Action, is therefore an urgent call for all of us to continue to collectively voice that menstrual health and hygiene and sexual and reproductive health and rights should not be an addendum or an afterthought in the COVID responses. The sharing of the valuable knowledge, perspectives, insights, and experience from our esteemed panelists and the audience today will allow us to understand better the impact that the pandemic is having on menstrual health and hygiene, and how we can better influence policies and programs, because indeed, this is an important time to do that. We know that from the stringent lockdowns and restrictive policies introduced by governments to contain and curb the spread of the virus, we have seen not only discontinuity in family planning and maternal health services, but also routine gynecological clinics and elective procedures, many of which are symptoms sometimes of menstrual abnormalities which do exist. We have seen disruptions in supply chains and last mile distributions of sanitary products and contraceptive supplies. We have seen suspension of the free pad distribution and comprehensive sexuality and menstrual health educations that we were actually promoting and was happening in schools. We've seen closed small industries and local manufacturers of sanitary wares and products. And we've heard of heightened discomfort and embarrassment expressed by many menstruating women and girls in townships and informal settlements where toilet facilities, water supply, and waste disposals are simply not adequate. And we've also heard that in some of our isolation and quarantine centers, there has been no consideration given to provide menstrual products. And the frontline workers, 70% of who are women, are not able to manage in dignity and comfort their periods as they work those rising COVID cases. But I think would be, those are things that we have seen, we've heard, but we've also seen, I think, resilience, opportunities, and innovation as new and alternate ways are being found to educate, inform, provide, and address needs of those who menstruate. So dear friends, periods do not stop for pandemics, and neither must we. We must seize this unprecedented moment to build back better. I know as the Africa Coalition membership that has grown to over 500 members strong since it was established in May 2018, and with support from partners, including the Global Menstrual Health Collective, and leaders and champions in countries throughout the world, we will continue to boldly and urgently take action so that every woman and girl can enjoy their sexual and reproductive health and rights and not be limited or held back by their periods. I thank you and be rest assured that UNFPA will continue to be an active partner for this cause. Thank you, Justine, and back over to you.
Thank you. Thanks so much for those opening remarks, Julita. I don't know how we all clap on a virtual platform, but thank you. I think that really set us off well for today's session. So before we move into the main program today, because I know sometimes we're all grappling with this new technology, I just want to be clear how we'll be interacting. So if you're currently in the audience today, you're actually muted, and I would have to unmute you to ask the question. So during the presentations, we will have short time for questions, and at that point I'd like you to actually type those questions into the Q&A box. If you click on Q&A along the bottom screen, you'll see that. Don't worry about typos, that really doesn't matter. If you can give us your name, which country you're based in, and if you're affiliated to an organization or if you have a particular role like youth activists, do share that and then type in your question. We're actually going to extend the session by 20 minutes today because we feel there's just so much to discuss and share, and we really want to hear from as many from you online as possible. So as we get to that final session, I will then be able to open it up where you can ask questions directly, and you'll have to put your hand up to do that. So we're going to move into our first presentation now, and we have with us Ms. Laura Amaya. So she's the Associate Director at FSG, where she leads FSG's Gender Equity and Latin America Practices work, and she's overseen project work in over 20 countries around the world. And Laura's also co-authored several FSG reports, including one on advancing gender equity by improving menstrual health. So I'm very pleased to have you with us today, Laura. Over to you.
Thank you, Justine, and thanks to everyone who organized and who are participating in today's webinar. I think it's a really important topic, made all the more important, as Dr. Julita said, due to the COVID-19 pandemic. I am delighted to share some insights from FSG's recent report, Advancing Gender Equity by Improving Menstrual Health, which was published in April, so just a few weeks ago, and supported by the Bill and Melinda Gates Foundation. Over the next 10 minutes or so, I'll walk you through some of the core challenges that are still present in the MHH landscape around the world. Then I'll outline key opportunities for action to improve MHH, and I'll wrap up in a couple of minutes by contextualizing how these insights are still, and are perhaps even more relevant during the COVID-19 pandemic. So starting with the scale of the challenge, today over 500 million women and girls around the world do not have what they need to manage their menstruation. This number is likely larger given the pandemic and the constraints that it's placed on menstruators around the world. And this includes a lack of menstrual products and materials, but it also speaks to poor access to appropriate wash infrastructure and a lack of knowledge and awareness about menstruation, among other things. Now, the challenge is present across geographies, as you can see on the slide, and it's also present within individual countries, both developing and developed. Now, in the research that informed our recent reports, we found that there's a correlation between increased economic standing at a population level and improved MHH. And so in countries like Uganda or Ethiopia, you can see them on the left-hand side, that have lower per capita GDP, less than 40% of women report having everything they need to manage their menstruation. By contrast, a country like Indonesia, where per capita GDP is nearly 4 times as high, close to 80% of women report having everything they need to manage their menstruation. Now, what's really interesting, however, is that within countries, it is actually stigma and cultural norms that affect MHH. And these aren't necessarily correlated to wealth. So in some countries, it is women in the richest quintiles that do not participate in daily activities due to menstruation or during their menstrual period. And in some other countries, it's actually women in the poorest quintiles that are excluded. And so we'll come back to this again, but social norms, cultural norms, gender norms, and stigma around menstruation have a deep impact in improving MHH for women, girls, and those menstruators that do not identify as women or girls. We continue to see that improving MHH requires an interdisciplinary approach that bridges across the silos of sectors to consider the full experience of a woman with menstruation throughout her entire life. So how does knowledge and awareness of menstruation affect her and her partner's reproductive health choices at different stages of life? How does access to menstrual products of her choice shape a woman's experience with menstruation? How does the type of wash infrastructure that she has access to have an impact in her well-being? How do then the social and gender norms influence how she and others perceive menstruation? And then finally, how do broader policies and systems related to menstrual health and hygiene perpetuate or break gender inequities? Over the next few minutes, I'll summarize some of these findings, but I do encourage you to read the report. You can find it on the link at the bottom of this slide or on our website at fsg.org. So in terms of awareness and knowledge of menstruation, we see that there is greater awareness among the field of the importance of puberty as a pivotal moment in a girl's life. And there's also a recognition that beyond puberty, menstruation must be considered throughout a woman's life. However, there are key gaps that remain. So a significant proportion of girls still do not know what menstruation is when they get their first period, and this number is higher than 70% in a country like India. We know that this then impacts how women and girls perceive menstruation later in life. And in fact, 80% of teens who are out of school and therefore less likely to receive appropriate knowledge and have appropriate awareness of menstruation report feeling shame when menstruating. And as a woman moves further into her reproductive years, the lack of knowledge also translates into barriers to contraceptive access and to appropriate family planning for women and their partners who do not have a clear understanding about the link between menstrual health and hygiene and their sexual and reproductive health choices. Now, in terms of product access, we see that products are increasingly viewed as a component of a broader set of solutions rather than a standalone fix, and that's really encouraging. What's even more encouraging is that there's a range of actors who now recognize the importance of informed product choice and not just access to any type of product. However, there's still a trade-off between cost and quality. And this is particularly acute for rural populations. So menstruators can find either high quality products that are expensive or affordable products that don't necessarily meet their desired quality standards. Now, at the same time, there is growing awareness of environmental concerns that influence the conversation about menstrual products more and more. And this is in terms of composition, in terms of use, in terms of disposal. And this is undeniably encouraging from an environmental standpoint, but it could also be a barrier that exacerbates the cost and quality dilemma if organizations see this as a challenge instead of a sort of opportunity to innovate. So as we know, sanitation has been the entry point to MHH for many organizations, including some of you today. The good news is that there are more efforts to integrate menstruation into sanitation system design, including in disposal and in waste, which links back to the sort of environmental concerns around waste management. And then in addition, the wash sector is moving towards a more holistic approach to wash that also addresses social norms and also addresses menstrual health education instead of only focusing on sanitation and product access. And that's encouraging. Now that said, there are still key challenges in terms of access to the right kinds of sanitation facilities. And this includes facilities that are private, facilities that have clean water and soap available, and the availability of appropriate disposal systems, both for menstrual products and for menstrual blood. Now, as I mentioned earlier, stigma and norms play a critical role in shaping a woman's experience with menstruation throughout her life. And this is even more important for those menstruators that do not identify as women or girls. Now, stigma around menstruation is present at the individual and at the community levels, shaping those harmful social norms that negatively impact individuals during menstruation. But stigma is also pervasive across levels, including at the institutional level, with MHH overlooked in leadership and in decision-making, and at the sort of broader systems level, with menstruation being absent from media, from public discourse, and from policy. And so here we see a need to address stigmas and taboos, not only in communities, but within our own network of organizations, including those of us here today. Now, the good news is, again, that as the focus of MHH has evolved from just girls' education to broader considerations on a range of other outcomes, there are more actors who now see an imperative to invest in MHH as a way to advance gender equity. And there's the emergence of strong coalitions at local and at global levels, one of whom is part of the organizing committee of this webinar, that hints at a change in how organizations address MHH. Now, the challenge is that funding for MHH still remains limited and is largely focused still on sanitation, despite a sort of handful of more innovative funders who are trying to move beyond sector silos. So with that in mind, what opportunities are there to improve MHH? So in our research, we identified a range of opportunities, big and small, and in our report, we have highlighted 6, which we think are probably the most important and the ones that either have a strong momentum behind them or where there's a need for more actors to support and catalyze change. The first one on the top left, you can see, is to build the data and evidence base. And this helps improve coordination among actors, and it also increases resources and improves the utilization of existing resources for MHH. There's also the importance of engaging both women and men to improve knowledge and awareness of menstruation, and therefore lead to better sexual and reproductive health outcomes. There are 2 opportunities related to menstrual products. The first one is to innovate in order to create new menstrual products that meet the unique needs of women and girls in different contexts and very specific contexts. And then second is to sort of break that cost-quality trade-off for the existing portfolio of menstrual products by engaging both corporate actors and social enterprises, as well as a range of other actors, governments, NGOs, international organizations and foundations. There's of course the need to design and continue designing wash solutions that address critical issues such as the management of menstrual blood and the disposal and reuse of menstrual products. And then there's of course an opportunity to tackle stigmas and taboos related to menstruation across levels, so from individuals to institutions and broader systems. Now, when we wrote the report and when the report went into publication, it was sort of right at the junction when the COVID-19 epidemic blew up into a global pandemic that we're all affected by in one way or another. And so in the weeks since the publication, we've actually seen different ways in which the MHH landscape has been impacted. And Dr. Julita touched on a number of these. So there are challenges to women and girls accessing menstrual products as supply chains have been broken, whether that's public or private supply chains, and households face increased economic pressure that have to make trade-offs in terms of household spending. There are disproportionate impacts on specific groups. So one example is healthcare workers, 70% of whom are women and have challenges either accessing menstrual products or actually being able to manage their menstruation due to the complexity of sort of putting on and taking off the protective personal equipment. And then there's the fact that attention has moved away from MHH, both in terms of funding and in terms of sort of research and implementation, many of which efforts are sort of on hold due to the emergency and the restrictions placed by governments to prevent the spread of the virus. And beyond these impacts that I highlight here, and I'm sure other panelists will touch on some others, UNICEF has actually published an excellent brief last month that some of the people in this webinar were contributed to on the impacts of COVID-19 in MHH. And I encourage you all to look into it. I suspect that many of you already have. Now, we also see that the pandemic could present an opportunity to fast track MHH response. And again, as Dr. Julita said, sort of build back better. So in the US, for example, the CARES Act, the government's response to the pandemic, included a provision for the tax-free purchase of menstrual products. So could this then be rolled over to non-pandemic times or to other geographies? There's also a greater focus on hand washing and clean water and soap. Could this lead to designing wash solutions that also meet the needs of menstruators in terms of privacy and in terms of hygiene? And then finally, as governments and organizations think about this pandemic, not only as a way to sort of how do we get back to normal, but how do we sort of quote unquote build back better, we believe that there's definitely scope to have a specific focus on MHH as a way to continue advancing gender equity. Thank you very much. I can take questions, I think. I don't know if we've got time, but Justine, over to you if we've got a couple of minutes.
Thanks so much, Laura, and that was a great way to start our session today. You covered so many things, and I think it was really great to hear you talking about this idea of this broader focus and breaking down the silos between the different sectors, because for those of you that joined us for our first Africa MHM symposium just over a year and a half ago, you'll remember that that was one of the key objectives when we all came together, was really to look at it in a much more multi-sectoral way. So I'm going to open it for questions. If you would like to pose a question, you need to go into the Q&A section and type your name. So I have a first question for you, Laura. This is from Chebet from Kenya. And the question is, you know, the sense that menstrual health management's been left behind actually in health facilities, particularly for patients that are admitted. And so to what extent did you look at those specific menstrual health needs when you were doing your research?
So the answer is we didn't. The research was all pre-pandemic. But we have seen, yeah, that is another big concern. The lack of PPE is not only affecting healthcare workers, but the lack of critical supplies, including menstrual hygiene materials and products, is affecting healthcare workers and, of course, patients. And that's exacerbated by the fact that in many countries, patients can't actually see their families or other people in their support network, so they can't have access to sort of external materials to the system. And so we see that the systems, health systems, are really becoming overwhelmed at different levels as the pandemic moves across geographies. But yeah, it's a really interesting point and something that we sadly didn't look at in our research.
Thanks. And our next question is from Anonymous. But to what extent, when we look at opportunities in the COVID-19 recovery to really prioritize menstrual health, to what extent do you feel that tax exemption is a key facilitator of increasing access?
That is a really interesting question. And as far as I understand, there is some ongoing research to understand how tax reductions or tax exemptions could increase product access. There are many countries that have tried them and seen that it doesn't actually increase product access because the margin is kept either by the retailer or someone else along the distribution chain. And so there may be other ways to think about policies, including, for example, the implementation of product standards, which regulate sort of products across the spectrum or the existing portfolio, or exemptions to tariffs and taxes on imports and sort of import duties that could lower the cost of raw materials for local production. So I'm not entirely sure of the timeline of this new study on the impact of product taxes on affordability. It's certainly something that we've seen for many governments around the world doesn't actually translate into lower tax revenues or like significantly lower tax revenues. So there's an argument for the government to do it. It's yet to be seen whether there's an argument in terms of affordability for the customer.
Thanks. And just a final question that we can take at this point. So a question about menstrual cups. So are they safe? Do they fit into this overall approach to what you referred to as informed product choice?
So I think menstrual cups definitely do fit into the informed product choice approach. And the idea behind informed product choice is that a woman has as many products in the portfolio of menstrual hygiene products and materials to use the ones that she feels are more appropriate at different points of her cycle or at different points of her life. The question of whether they're safe, we have had evidence that they are safe. I believe it was earlier this year, or maybe late last year, there was an academic study published that proved the safety of menstrual cups. I think the two questions there are there product standards for menstrual cups that ensure to consumers that yes, they are safe and they have been sort of proven by the government to be safe? And then there's a question of social norms. So, and that links again to like the knowledge and awareness of menstruation, how that relates to your body. So products that are insertable through the vagina may actually be less comfortable, or women and girls may feel less comfortable in certain settings where like insertable products, whether they are menstrual health and hygiene or contraceptive products, are a little bit taboo. And so I think that's another key aspect, which is why we keep coming back to the importance of breaking down stigmas and taboos related to menstruation.
Thanks, thank you. And Danielle, just to say, I've seen your question and we'll come back to your question when we've heard more of the speakers. So at this point, I'd like to pass to Alice Wambua, really to just reflect on what's happening on the ground. So Alice is from Kenya. She's a youth activist working with Days for Girls as a menstrual health advocate. And she started a grassroots social enterprise in 2018 where she's reached 3,500 girls and women with Days for Girls washable pads. And she's also taught menstrual health education to over 15,000 women, girls and boys. So welcome, Alice from Kenya. Great to have you with us. So we really wanted to hear from you, based on the interactions you're having with the women and girls that you serve. What are the challenges that they're facing on the ground in Kenya? Alice, sorry, you're muted, Alice.
Sorry. Okay,
great.
Sorry. Can you hear me? Great.
We can.
I am Alice, one boy from Kenya, working with Days for Girls organization. I appreciate for this opportunity to be able to share what we are seeing on the ground together with other youth activists, especially during this time of COVID-19. So basically, as we all know, there have been scarcity and accessibility of menstrual products. And at this time, we have seen government focusing more on creating awareness about COVID-19, and less priority has been given on menstrual products. So finding it difficult for women and girls, to access. Apart from that, we have seen rise on menstrual stigma and shaming, and especially now with the lockdowns, they stay in a small area, and family on average between 8 and 10. And so these women being there and having to clean themselves, having to change their pads and all that, they have found it as a challenge. And bearing also in mind is that the place where they stay, they share the bathroom and the toilets. So practically, I've been able to go around community talking to teenage girls and women. And there is this woman who told me just the other day that she had soiled her dress with menses. And she went to her neighbor, to ask for help with something. And they saw her dress and they were like, oh, we don't even want to associate with you because maybe the blood in your dress could even transmit the virus, And so she was so embarrassed about the whole subject. We have also seen the rise of poor wastage of disposal of sanitary pads. Before COVID-19, girls used to go to school and they have different facilities there. Women go to different places of work, and now having the lockdown restricted to stay home and not move out there. We have seen used sanitary pad hanging on the walls, hanging on the backyard, almost all over, which is so unhygienic to them and also to the environment. We have also talked with women and girls that have found it a challenge to manage menstruation in privacy during the lockdown. And for example, during the day, because so many people are around within the same place, depending on the setup, especially here in Kenya, at night, this is the time women and girls find it, more comfortable for them to go out in the cold, which is unsafe, to clean themselves, to be able to change, more in privacy. Thus, affecting them psychologically and all that. So we have also seen infection on rise due to improper sanitary supply. And this is actually a sad situation where we have seen teenage girls and women without the menstrual product using the papers, like the newspaper, using the rags, And also we have seen a situation where teenage girls have shared with us, they had to stay longer hours than usual with the disposable pads. And some of these women also, they reuse that. They put it on the roof to get to dry. You can imagine that. And then they will reuse that. And the same roof, when it's raining, they use the same system also to harvest water for drinking, for cooking, for washing, clothes and all that, subjected them to unhygienic measures. Just the other day, we saw on the television in some places in Kenya, they say that some parents are marrying off their girls, especially at this difficult time, so that they can get some money to put food on the table. And in Africa, basically, a girl, when she starts menstruation, she's considered a mature woman, ready to have a family and start her own life. And thus, this has been subjecting, girls and women to such a horrible situation. Thank you. Back to you.
Thanks, Alice. I think, all really important experiences, and we'll be coming back to you a little bit later to hear more of your reflections. I now want to turn to Janet Mbugua. So Janet's a Kenyan media personality and gender equality advocate with a particular focus on menstrual equality. And Janet, my question for you is, when we hear Laura and Alice talking about stigma and taboo and the challenges we're facing with menstrual health rights during this time of COVID-19, what role does communications play in that space, and how have you been using communication to help address menstrual health rights and access?
Right. Thank you, Justine. Hi, everyone. It's great to be here. I think communication is so key because it's the inroad to completely debunking a lot of the issues and misconceptions around menstruation. My background is in media, and then mainstream, I was a news anchor, and then kind of transitioned my communication more online and just found a very organic way to engage people on it. But what then happens is that it becomes a trusted platform people to talk about the issues that they're facing, the issues around them. So I look at it in a three-pronged way. I look at advocate, amplify, and act. And that's kind of how I execute the kind of communication I do. So with advocacy, it's around awareness. First, let's talk about being comfortable discussing menstruation. Because in Kenya, as I'm sure Alice will tell you, and I'm sure many other parts of Africa, it's really a taboo subject. It still is, it's changing, but it's still deeply taboo to a point where teachers are afraid to talk about it in class with students who are already menstruating. There's still a lot of myths and taboos that really hold girls and women back from thriving. There isn't much empathy from a lot of the male custodians of these cultural taboos. So let's advocate first. Let's get people to understand why this is so important. Let's talk about period poverty, menstrual inequality as well, and some of the other issues that are more biological. And so with communication, I've been doing interesting sessions, for example, throwing a virtual period party. Why did I think that was important? A period positive conversation. Thousands of people came on, and mothers and daughters also joined, just to kind of understand, how do I also translate this information to my daughter, to my cousin, to my little sister. So in as much as it's been done for some time, I tend to be a lot more intentional and almost to a point aggressive about constantly talking up this conversation, even where men are welcome to it. And then through that, especially during COVID, for example, on my platform, that a lot of women and girls' cycles, as is expected, have completely been disrupted. But more than that, a lot of girls and women are not accessing clinics or gynecologists for fear of, why would I want to go somewhere that's a COVID hotspot? And so then you're having a lot more issues around sexual reproductive health and rights, extreme pain, a lot of them saying they have days where they're having excessive bleeding, something they're not able to cope with. And so trying to use that information to speak to healthcare workers and say, there's another issue that's happening here. Their periods are being completely disrupted. They don't have access to the right kind of, for example, family planning or medication that can help manage their excessive bleeding and extreme pain. And who knows what other issues could arise from that. So women and girls are deprioritizing their sexual reproductive health and rights for fear of stepping into a clinic because it's a COVID hotspot. And so communication is so key. It just allows a platform where people who don't usually find it in them to have this conversation are not only asking the right questions, but are seeking advice, whether it's medical advice, social advice, period product advice, advice around their cycle, around period poverty, and the action they want to take to play a role in ending it as well. And so that's really the power I've seen in using a digital platform to host various conversations and just inviting everyone in and asking them, what are your thoughts and how do we use this to draw on something that's a lot more holistic when it comes to solutions?
Thanks so much, Janet. And actually, I just have a question for both you and Alice, actually, before we move to our next presentation. Because it's an interesting one. So, and it's actually from somebody who's chosen to be anonymous, but just this idea that, you know, women have been menstruating since the beginning of time. And so why is it, do you think now, that we have this much stronger focus in the region across the continent to support menstruators? There's growing research, there's growing multi-sectoral approaches, but why now? What's changed? Shall I come to Alice first? Any thoughts on that, Alice?
Okay, I think what has changed is that, especially during this pandemic time, before that, girls and women, they had more opportunity, maybe through schools forums and other forums, to get this education and maybe to get some help with menstrual products and the education they need. But now we feel with the restriction, with all the challenges with the virus, the challenges that has come in, has made it more difficult for teenage girls and women. And that's why we feel now watching this like child marriage being on rise because of, you know, the challenges that have come with COVID-19. Like, we feel this is such an important subject to intervene at a time like this, because otherwise, if we go silent, more things are going to go wrong. And as we all know, periods don't pose for pandemic. This is just a subject that we should continue being on the front line to share, to help people to understand the importance of it, and, you know, trying to break the stigma. And especially the place I come from, Africa, most of it is attached with stigma and all that. So we feel it's time we continue to break that silence, continue being there to for teenage girls and women, involving also boys and men, because we believe for them to understand the whole subject, they are the key supporters to girls and women as well.
Thanks. And Janet, any thoughts from you? And actually, as I'm facilitating today, I'm sort of remembering that when my period started at 14, I sort of had to scurry into the local supermarket and sort of put the pads in the basket and hide them under a loaf of bread. And, you know, I mean, there's stigma and shame, I think, in different cultures at different times as well. But, you know, things have changed, for example, where I come from. But, you know, are we now really seeing a change in the continent at this point, Janet?
I think there's a slight shift, but there is still a lot more work to be done. I think what's important now is that the advocacy is a lot more. The conversations are now being mainstreamed, you know, having them even in the media on a primetime news network for them to have the conversation. That wasn't really seen a while back. I think it was early 2000s when we had the first radio presenter really being vocal on air, and she was really lambasted for talking about something so private. Many years later, there is a slight change. We're having even the president recognize that this is important. He signed an amendment to make sanitary pads free for girls in Kenya in 2017. So, you know, we are seeing it, but the stigma really remains, especially in cultural settings where women and girls are not allowed into the house during their period. You're dirty, you should stay where the livestock are. Women who are still sitting over holes for 5 days during their menstruation. That's really where the messaging needs to get to. And hopefully with a lot more advocacy, amplification, communication, we'll also have public participation. That's another reason why the comms bit is so important. I had a petition out last year that has about close to 40,000 signatures, from a lot of them from men, saying we need to end period poverty and we need the government to implement the policy. So it is changing, but there is still a lot more that needs to be done, especially taking these kinds of conversations to the grassroots where the stigma and poverty exist every single day for girls and women.
Thanks so much, Janet, and I'll come back to both of you again a little later on. So if you remember from Laura's presentation, you know, she talked about the importance of informed product choice. And now I want to pass to Charlotte Soulery. So she's from the Reproductive Health Supplies Coalition, really to tell us what their research and evidence is showing in terms of product access. Over to you, Charlotte.
Hello, and thanks for inviting me to join this important discussion. Yeah, so as you said, we are a global partnership of organizations dedicated to ensuring access to reproductive health pillars, availability, quality, equity, and choice. The COVID crisis and we've been monitoring that with our supplies workstream. So as we are seeing, the COVID crisis has led to a global supply crisis and disrupted access to menstrual health materials, particularly disposables that require monthly replenishment. From a supply perspective, we and our member faced three main challenges: disrupted production of supplies, many interruptions throughout the supply chains, and delayed or failed product delivery. I won't develop on the challenges, but just it's important to remember that these challenges existed before the COVID crisis, and particularly at the last mile. So they've been exacerbated by this crisis, but we have still to solve them on the longer term. So the current situation, and especially the lockdown measures, have huge economic impacts. And financial stress may lead families and women and girls to prioritize other needs, such as food or essential utility bills, over purchasing menstrual health supplies. So to mitigate these impacts, we've already seen many innovations, and I think there are lessons not only to ensure access to supplies during the crisis, but also for the world post COVID-19. The number one, to avoid supply chain disruptions, it's critical that reproductive health services and supplies, including menstrual health supplies, are declared essential and integrated into COVID global response. It means that when they are listed as essential commodities, it will just we've seen that in India. I think it was mentioned already that menstrual health products were not considered essential supplies when the lockdown started, but thanks to menstrual health advocates, they've been integrated in the essential list after 1 week of lockdown. In Uganda, I think it's AfriPad reusable menstrual kits that are classified as essential goods and services. So their factory was able to stay open, and they were able to manufacture their kits. Second, want to insist that the same applies to humanitarian settings, and it may require advocacy to ensure humanitarian movement can continue during the lockdowns, so they can still access field locations. As everywhere, it's a non-negotiable minimum standard, so it must continue during such a crisis. To mitigate supply chain disruption, it's also key to collaborate. That's what we do in the coalition, and there are interesting learnings to share from the family planning community on this, even if we really have to recognize and look deeper into the differences between family planning and menstrual health supply chains. But in the family planning community, we work on monitoring stock levels within the supply chain, in particular under the umbrella of the Global Family Planning Visibility and Analytics Networks, the Global FPVAN, which is helping us to assess the risk of supply chain disruptions on orders and shipments. But to be able to do that, it requires that manufacturers, procurers, and country stakeholders share data to ensure supply chain visibility. So it's something we may want to look at for the menstrual health supply chains as well. We also set up coordination bodies to anticipate and address distribution and organize stock transfers from one country to another when necessary. That's also something that could be possible from the family planning sector, that could be possible in the menstrual health supply chains. Then I also wanted to speak a bit about distribution that needs to be adapted. We've seen that when schools and retail shops are closed, many partners have had to change their distribution channel and ensure home delivery of supplies. Or some of them worked with the community health workers and mobile health, and they include the menstrual health supplies in the reproductive health services and products that are providing door to door. And I think these examples are very useful also for the world post-COVID, because they show why it is so important to continually push for integration of menstrual health supplies in reproductive health and global health programs. And lastly, and I will stop after that, sorry if I'm a bit too long, when supply chain is disrupted, as we really see, the sustainable products are critical. So it goes from production with local materials to use of reusable products. And there's been a lot of innovation happening in this field, in this area. I can mention AfriPad and Women, but we could mention many other organizations who develop innovative, sustainable products. So if they are partly motivated by the need to reduce the environmental impact and the cost of buying every month, reusable products are also useful to increase autonomy and to avoid relying every month on global and national supply chains. There really need to be more support in this area in the future. And then it's been said already by a few participants, but a final word on period poverty. We know that many low-income women cannot pay the cost of commercial supplies, and now that the costs are likely to rise, it will be even worse. So we must continue look deeper at the removal of sales taxes from menstrual hygiene materials, and also to other types of mechanisms, such as free distribution in schools, to be implemented again as soon as possible when we go back to not normal but better.
Thanks very much, Charlotte. If you have any questions for Charlotte, can you type them in the box? I do have one for you though. So this question's from Rose Kamariza in Burundi, who works on youth sexual and reproductive health. And she's asking, what type of evidence do we need to collect if we want to collect evidence at community level? And I think that, you know, when we get to supply chain, it can sometimes seem quite technical and up here somewhere. And if you're working in a community, it can feel as though you can't really influence that because, you know, it sits with national government in the capital. So is there any evidence gap or any way that those working at community level can gather evidence that will in some way support the advocacy to strengthen supply chain for menstrual health products?
Yeah, we really need community voices to do better advocacy. That's what we are doing with the menstrual health supplies work stream of the coalition. We have both global, national, and local organizations who join and collaborate and also share that kind of difficulties. The main thing we need to know is about stockouts. As I said, it's even worse at the last mile, so really in rural areas, and when there is a disruption at on the supply chain somewhere, as I said, from the global to the global supply chains to the last mile, the evidence is at the last mile. It's in the community at the point of use. So we need to have this information. Governments need to have it. It's the only way for us to make them change their policies. It's when we see that the shelves are empty. So I think there are more and more coalitions being built at national level, and it's very useful for that. And at the global level, feel free to join our work stream because that's really what we try to do.
Excellent, thanks Charlotte. And I know now that you've mentioned that, there's going to be lots of people on the chat saying, we want to join, how do we join? So based on a few questions I've seen, we will be sharing PowerPoints, we'll be sharing contacts, we'll be sharing guidance on how you can join some of these initiatives that are being mentioned during the presentation. So please don't worry, we'll be making all of that available to everybody. Okay, so maybe following on from what Charlotte discussed and some of the environmental issues and discussions and debates that surround menstrual health products, I now want to pass to Jasmine. So Jasmine Burton is with the, sorry, I've lost my notes. So Jasmine's with the Toilet Board Coalition, and she's going to share some lessons learned on MHM and waste disposal, particularly looking at those in the context of the COVID-19 era.
All right, hi everyone. It's so great to be with you all today. So my name is Jasmine, and I'm really excited to be here to speak with you on behalf of the Toilet Board Coalition about periods and pandemics, particularly about menstrual health as it relates to the sanitation economy. Just as a preface, I am a hybrid professional within the water sanitation and hygiene space. I work as a product designer, a social inclusion specialist, as a sanitation entrepreneur that also supports sanitation entrepreneurs through the accelerator program at the Toilet Board Coalition. So to provide a little bit further context, the Toilet Board Coalition is a business-led platform and partnership that really is looking to address the 6th Sustainable Development Goal with business prowess. So we're looking to unlock the biological and natural resource flows about human data and information and behavior that is really untapped in a lot of sanitation systems. And so our goal of doing this work is to transform the historic public cost of sanitation to being revenue generating opportunities. So how do we make sustainable sanitation solutions rather than them being sort of burdening the public sector explicitly? Looking at all these logos at the bottom, this shows the diversity of our coalition. So we have corporate representation as well as donors, as well as NGOs, academics, and our sanitation entrepreneurs, really all coming together to drive innovation in the sector. So when we talk about the sanitation economy, we're referring The bottom green part is the circular, the smart sanitation economy is perhaps something that we're all toilet product and service innovation that provides toilets that are fit for purpose for all contexts and incomes. And when you look at this graphic, you can see that this is representative of container toilets, pan toilets, bio toilets, so lots of different types of toilets based on your context, preference, demand, things like that. But you can also see that there's products beyond that, and we call those toilet adjacent products. So cleaning services, cleaning products, maintenance, and also menstrual health products are represented within this sub-economy as well. So really looking at the collection mechanisms for what we call toilet resources, or what other people call human waste. As an example, bus, old municipal bus, anything that could be needed in a safe, private, secure location. So that's just a representation of what toilet economy innovation looks like through our accelerator program. Moving to the circular sanitation economy, this is really where we start looking at the value that toilet resources or human waste could potentially offer to society. So this is looking at the biological cycle and upcycling nutrients and creating value-added products such as renewable energy, fertilizers, proteins, etc. So some of the businesses that you can see in this graphic, they're actually doing that within the sanitation economy, looking at how can you transform human waste instead of in a linear approach, like traditionally trying to get waste away from people. How do we operate in a
I've lost connectivity. Is it just me, or are other people struggling to hear? Yeah.
Yeah, her network is bad.
Yeah, Jasmine, I'm sorry, but we seem to have lost you. Okay, I think we could have lost Jasmine.
Is this
completely. Still with us?
better? Hi, sorry about that.
It's okay. So can I suggest, because you've got slightly bad connectivity, because we will make the slides available after your presentation. So maybe just try and cut it short, and we'll then always do questions through the chat as well.
Yeah. Yep. That's perfect. Okay. So I think just so I can address the smart sanitation economy, this is basically looking at technology as it relates to sanitation. So what opportunities exist by integrating sensors into sanitation infrastructure as it relates to health and monitoring and operations. So these are just some of the opportunities that exist within the sanitation economy to drive innovation that we're really proud to support. And GARV is one of our premier examples of that. They're using sensors to monitor and mitigate vandalism in public toilets in India. As we've sort of expanded the accelerator program, Sati was our first organization that operates within the menstrual health space, which we're really excited about. They make biodegradable, compostable pads. So operating both within the toilet economy as well as within the circular sanitation economy. So how, upcycling waste. And then we, this year, have Pad Care Labs, and they actually have a circular approach as well, where they have an eco-friendly incinerator that they're looking to start scaling up to provide, or basically to transform hazardous sanitary pad waste into harmless reusable material. So we're really promoting this idea of how can we create and drive innovation for more of these circular approaches. In November of last year, we were really excited to launch this For Women by Women workshop at our Sanitation Economy Accelerator, where it became very clear that our members and entrepreneurs were really calling for some type of programming within the Toilet Board Coalition that supports women-led sanitation enterprises, or any sort of women's health focus within the sanitation economy, be it menstrual health, incontinence, pregnancy, etc. to help kind of further and enable those innovations to thrive with private sector corporate mentors and resources to enable, the R&D that's needed for quality control and for scale. So we're really excited that we're piloting this Women in the Sanitation Economy Innovation Lab beginning this year with Kimberly Clark. So stay tuned for that. And if you're interested in learning more, I would love to continue the conversation. So as it relates to COVID-19, the Toilet Board Coalition, as well as I'm sure everyone at this point has been affected, and we're seeing a number of things. And so the accelerator director of our program has said that, our sanitation entrepreneurs have seen disrupted revenue. Has been quick to bounce back. So it's actually been really interesting. He phrases it as a recession-proof nature of the sanitation economy. So basically saying, if we can build strong businesses around these innovations that are adding value to the people and to the environment, there is a really strong value proposition that makes it so that it's more or less recession-proof in hard times like COVID. So as there have been challenges, we've seen a lot of resilience from our entrepreneurs, which is fantastic. When we ask about examining or the lack of consideration of menstruation in the existing sanitation solution, how will that contribute to the challenges of the MH space? We look at pad care labs, and they're basically saying because of the lockdowns, there's been a lot of waste that's just been continually thrown in the streets. A lot of public dustbins are not accessible, and menstrual waste is being combined with other waste, and which is furthering environmental burdens. So again, this is sort of a call for continued circular approaches, and how can we create those on a household level as well as on a community level, that they can sort of create more resilient systems for menstrual waste management as well as just all waste management in general. And then as we move to the innovative solution side, the venue, our accelerator director, had this fantastic realization that a lot of our sanitation entrepreneurs have sort of had these pivots, these short-term pivots where you go from making toilets to making hand sanitizer or hygiene products so that you can continue keeping your business open, but also so you can continue adding value to what's happening in the sector right now as it relates to COVID. But there's also been some really big long-term pivots that have been happening in our business models that we've observed. He calls them COVID-19 friendly, but basically being resilient models where sanitation, specifically public sanitation options could be, opportunities for last mile testing, right? And for hygiene distribution centers. So how can we kind of think beyond just the toilet provision to something that's actually, providing, expansive value to society and communities? So that's something that we've seen, and it's really cool to see sort of our entrepreneurs being really reflexive during this time. And then Sati, again, they are the ones that are making the biodegradable pads in India. They're coming up with this sustainability box, which has menstruation and physical, products related to menstruation, which I think is really cool that they're packaging, a lot of different things within their product offering. And something that also is like an aspirational value and sort of recognizing the psychosocial stress that's kind of coupled with what's going on right now, and sort of how can we make people feel empowered and dignified during this time. Also, I think it's really interesting that they're pivoting some of their innovation to make biodegradable masks as well, to again contribute to the circular waste management of what's going on with COVID, using what they're already doing and being reflexive to the situation, but then also saying we're gonna not be adding trash to the world, we're gonna actually be creating models that are sustainable. So I think that that's really a fantastic example of innovation as well. And I wanted to end with this, this plug. So I'm a product designer, and I've been working with other product designers on a series of provocations about what the future of periods could look like. We've been using a design thinking methodology through a design sprint over the past 3 weeks, where we've talked to 40 experts from around the world in various capacities. And we've really come up with a series of ideas that were intended to spark curiosity and conversations about what the future of periods could look like, as a means to invite more designers, innovators, engineers, and creators into this conversation, so that we can, bring some more of that expertise into the sector to help drive innovation and scale. So I would invite you to join us. We're launching tomorrow. And if you have any other questions, I would love to answer them now. Thank you so much.
Great. Thanks so much, Yasmin. That was a great presentation. So any questions for Yasmin? Just as you're typing them in, we had an interesting comment from Hyacinta Ntuyeko from Tanzania. And what she's saying is what she's seeing is as people are restricting their movements and because women are staying home more, to save money, they're actually not buying sort of commercial menstrual health products and going back to more traditional products. We also have a question. I don't know if you feel you can answer this. It's fine if you don't feel you can. But Rhoda from Ghana, so she's the Days for Girls Tamale micro enterprise leader. And I think she's been looking at a micro enterprise around reusable sanitary pads. But what she's finding is that some people are resistant to them because they're saying that they cause infection. And so how does she advocate for those, bearing in mind that they're actually a more sustainable option as well? I don't know if you'd like to respond to that one, Yasmin.
Yeah, so I know that the behavior change piece is, it's always challenging. I don't have an exact answer to that because I do know it's case by case in terms of how, you encourage uptake of new products and services. But I will say that, again, from more of a product design lens, when we look at the options that exist for menstrual health right now, and then we compare that to the number of options that we have for something like a car or for like toothbrushes or something, you see that there's so much diversity in product offerings for things like that, so that you can choose, right? And so this option, this idea of choice is really not as pervasive within the space. And so that's why I think it is really important for us to continue driving that innovation, because ultimately it would be fantastic if we had, if reusable pads aren't something that are going to land with some people, maybe there's a series of other completely different options. I know Danielle Kaiser from Menstrual Health Hub has provocated with me a number of times on this about the idea that, the products that we have on the market today are pretty much, absorbing and collecting. And those are sort of the main functionalities of them. What if there was other options? What if there are other ways to manage menstruation? And, how can we use communications and inspire other people to join this conversation to help drive, further innovation? So yeah, I mean, I don't have an exact answer, but I will say that it definitely makes the case for continued diversity in the space from products and also skill sets.
No, thanks. And I think your whole design sprint sounds really exciting, but I think just to remember the words of Alice, so where there's no privacy, where there's 10 people in a home, where there's no water, if we could deliver an innovative solution for those menstruators, I think that could really change the world. And I think that's what many of us online are really looking for is, some of those more traditional commercial offerings just aren't working in those settings. So what can we do to really help those menstruators with, realizing their menstrual health rights and needs? So thank you. Okay, so as we've been going through the session today, there's been lots of questions about schools, sanitary programs in schools, what's happening now schools are closed, how can we use the school space more effectively in terms of ensuring information and supply of product. So at this point, I'd like to move to Ranjini Devak and Megs Baksinksa. And they're going to be, so Dr. Devaki is from MEAT Africa and Dr. Baksinksa is from the Match Research Unit. And they're going to share a presentation with us on how we can strengthen school-based health and education systems to improve menstrual health management. Over to you, Dr. Devaki.
Ranjini, you need to put your microphone on.
You're muted.
You're muted.
I can do it for you, I think.
Is it?
Yeah.
We're good now?
Yes.
Good morning, good afternoon. I am from MIT Africa, based in Durban. Our organization is a not-for-profit education organization which aims to improve the life of children and youth. We are implementing a program on strengthening school-based health and education systems to improve menstruation and health management among primary school learners in 3 sub-districts of 3 provinces of South Africa, which is Eastern Cape, KwaZulu-Natal, and Gauteng. Our main goal is to increase knowledge and skills on MHM through promotion of menstrual hygiene in schools. So to achieve our goal, we have different activities we set up to achieve our goal. So we started with conducting a literature review and qualitative research to find a link between absenteeism and menstruation in schools, and to understand the extent of knowledge of learners, both female and male, on MHM through focus group discussions. So as we have discussed and we heard about the importance of advocacy on MHM, so we started with MHM sessions with the learners and the critical stakeholders, which included school principal, parents, SGB members, SMT members, religious leaders, community leaders, then social health workers and social workers. To integrate MHM as a school health activity, the following, we have decided to start with helping the teachers and supporting the learners to learn the newly revised syllabus, which, as you have heard about South Africa. From this new year 2020, they have DBE has rolled out revised curriculum on puberty and MHM. So MIT Africa is supporting the teachers and learners in learning this new curriculum. And throughout the program, we are monitoring and measuring the increase in awareness of knowledge and skill on MHM practices. So we assume that we are expecting by the end of this program an increased educational equity and decrease in absenteeism. As I said before, we started this program by implementing the activities. The main activity was to conduct a research on literature review and qualitative research. For that, we collaborated with MRU, Match Research Unit, to conduct the research. And that research team was headed by Professor Max, and Max is going to continue.
Can you move the slides on, Ranjini?
Yeah.
Just do the next one and the one after. Thank you. Stop there. So this is just the extent of the research data we've collected. No, go back up. Oh, no, up. Previous slide. Okay.
Before that.
Stop here. Thank you. No, the next one. The next one. Stop. Okay, that's it. Just stop there. So this, okay, I'll just explain the extent of the research. We've done qualitative and quantitative research, which was really looking at absenteeism and the effect of MHM on school attendance. But during the course of the research, we've collected a lot of data through a sanitation survey, key stakeholder interviews, focus group discussions, and anonymous survey amongst boys and girls in primary schools. So I think one of the key findings, because this is a webinar about how COVID has affected girls and young women, is in South Africa, we're lucky enough to have a very extensive sanitary towel program implemented by the Department of Basic Education, plus assistance from NGOs and some clinics. So the survey from 92 schools showed that apart from one province, the sanitary towel distribution program is quite extensive. And these are just a couple of the quotes from the focus group discussions, where the teachers, the parents, and the learners really find this a very important program, and it's really helping them. So this research was actually finished just before the COVID pandemic started, before the lockdown. So we're just finalizing the report now. But if you just move on to the next slide, Ranjini. Can you move to the next slide? Yeah, so just to show you what many of you will have heard, we've had an extremely restrictive lockdown. But even before the lockdown started on the 27th of March, the schools had already closed. So the schools have been closed for possibly 6 or 7 weeks now. There was no movement aside from essential services. You could go shopping, no exercise, and then it was extended for another 2 weeks. We're now in lockdown level 4. and the schools are planning to go back next week. So it's been a very difficult time for, you know, the whole population. And it's anticipated that some grades will only go back maybe in July or August. So really it's just a couple of grades, the senior grades, that are going back next week. So Ranjini is now going to talk about how they've contacted a lot of the learners to find out what the challenges have specifically been since the lockdown.
So thanks, Max. So our main challenge during the lockdown was how to communicate with these learners, because we already started our MHM sessions in schools, and we have, the girls themselves have organized MHM clubs where they share their challenges, they fear everything, they make posters, and so we were very well aware of the challenges our girls are facing in the school. So when the lockdown started, we were discussing with the team that how we are going to connect with these learners. So most of the learners are coming from rural areas where the unavailability of network, and some have cell phones, but they don't have enough data to communicate with us. So we decided to provide data bundles to these learners so that we can have access to them and provide enough information on COVID-19 and help them to support how to manage their menstruation during this lockdown period. And we wanted to know the availability of, sorry, I think the slide is moving so fast. Yeah, so the WhatsApp group chat has helped us to understand their main challenges, and we circulated all the messages and the advocacy messages we get from different organizations, and Days for Girls have provided us with a step-by-step guide to use washable, help them to make washable pads at home with unused clothes. Then the main challenges we faced, so through the WhatsApp chat, we could understand the main challenges they were facing. So we conducted a small WhatsApp survey with few girls who are active in the WhatsApp group. So the survey shows that 30% of girls have no sanitary pads at home. So they use old t-shirts and blankets, old blankets as sanitary pad, as menstrual product, and they don't know how to use that because this is the first time they are using clothes, and many of them have not enough water to wash these clothes. They have to walk miles to get water from the dam and rivers. So that's another challenge they were having. And in the primary schools, they used to get one meal per day. And when the lockdown started, they were not getting enough food, and basically they are suffering from period pains. When during the school days, they get the painkillers from the school, or they get it from the nearby clinic. So these are another challenge was disposal of materials. 90% of them use a spit toilet, so they were worried about the blockage. So they were sharing with us through the WhatsApp group the main challenges they were having through this lockdown period.
And I think generally in the country, it's been very difficult. There's been a lot of confusion. You go to a supermarket and there's been some sections that have been completely sort of taped off that you can't buy things. So this was something that came up in a supermarket where menstrual health products were not allowed to be sold. But also we've heard in the news of, you know, lorries with NGO supplies, which are trying to get sanitary towels to the communities, have also been stopped. So, I mean, this has, I think, moved on now, but these are the things that people have had challenges, you know, women going out of the house without having an excuse. And so this has been difficult to manage in the last couple of weeks. Will you go to the next slide? And then in terms of our results, we're looking at when, you know, we've had lots of hygiene regulations put into workplaces and schools, and cold water we found is available in all the schools, but really something like soap is not so available. So often the schools have got water in various taps and places, but to actually wash your hands properly with soap is something you may be able to do at home, but you may not always be able to have access to soap all the time at school. So that's something we really need to think about for all the learners, not just the menstruating learners. And one province has introduced this really interesting tippy tap system where you use your feet to just turn the water, the tap over, and you can wash your hands, which is very good for avoiding infection. But sometimes, you know, there's no soap, or the soap is just mixed up in the bottle. So thank you, Ranjini, if you want to finish.
Have some problem, it is stuck. I got some issue with my, it is frozen, I think. Let me see.
Do you want to just read it out, the last section?
Yes, the COVID-19 impact on MIT program is mainly the schools have been shut down since mid-March, which is affecting the implementation of the activities of program. And our beneficiaries are primary school learners, and we are not sure about the regular school activities are going to start. Then we mostly use life orientation periods and after school hours to do our MHM sessions, where the learners have organized the MHM clubs to share their anxiety and knowledge on MHM, which was going so well. The girls actively participated in discussing menstruation, puberty, and body changes. And this has helped them to develop confidence to talk about menstruation, especially with their boys, their classmates. And they were slowly increasing their self-confidence. And so we are worried that this during this 8 weeks of lockdown has really had a bad impact on our program, that it will affect the continuity of the program. Then it has, this lockdown also has affected our access to reach our main stakeholders, which include parents, school principals, teaching staff, school governing body, and school management team members. And it has affected the timeline to reach the learners with MHM activities. And for the way forward, what we have decided that we are preparing COVID-19 information in our advocacy session so that most of the learners should know that, and to train them to understand that periods don't stop for pandemic. And MIT has prepared a list of wash stations, which we are going to submit to our donor in the nearer communities where the schools are situated, so children will have the access to water. The next arrangement is to get enough sanitary pads so that these learners could store in their home if something like this happened in future, and train learners to face the next pandemic with sufficient knowledge to handle menstrual health management. Thank you.
Thanks.
I'm sorry about that.
No problem at all. I feel we're doing quite well considering all of the possible things that could go wrong technologically. So thanks, Max, and thanks, Ranjini. If you have questions following that presentation, if you could post them, and while you're posting them, I actually want to go back to Janet and Alice. So Janet, so what's coming through on the questions is, you know, what do we do? So we have a question from somebody who's chosen not to share their name, but they work in the slums of Korogocho, so Nairobi, you know, just talking about the fact that their people don't have access to the internet. We've had a similar question coming through from Maria Malo, similarly on, you know, what do we do around communication, particularly during the time of COVID-19, but I don't think it's a specific challenge to this period, on rural, you know, rural peri-urban communications across communities. And I didn't know if you had any reflections on that for Janet.
Yes, I do, Justine. I think that's where the importance of platforms like local radio stations come in, as well as if there's community health volunteers and workers, equipping them with the tools for advocacy, because they're on the ground with these women, men, and girls every day. And so, again, it's important to equip media, whether it's above, you know, mainstream media or social media platforms, to be able to have the right communication on ground. They will know how to speak through the local radio stations, the kind of communication needed for those demographics. Are we seeing it happening? Little by little. I think a lot of the information is coming from the digital space, but it is important that it's combined with the mainstream space. That's where the reach is widest. I know that in 2014, because of a story on extreme period poverty that showed girls using extreme unsanitary products like goat hide and chicken feathers and soil, that kind of thrust this issue into the limelight. And so it was on a primetime news channel where I worked as an anchor. And that's the difference it makes when comms is involved in a big way. Suddenly the parliamentarians were forced to discuss it on the floor and were forced to think about a budgetary allocation that is important for girls and women. So I think if we're looking at reaching girls and women who do not have access to social media, either you could use a USSD code on the phone if you know, they have community health champions who can access a very simple mobile device, or use the local radio stations, have some cutouts in the newspaper, something that they listen to every day, and making sure that the information is reaching them correctly. But public participation is everything. That's how we get to understand what policies work for everyone, from persons who are differently abled to how men can be involved. And that's how we also disseminate the right information to women and girls in informal settlements.
Thank you, great points. And just to say also, I've seen a comment coming through from Sazi from Safate in Zimbabwe, where they're just using an SMS interactive platform. So recognizing that some people may have phones, but the data is just too expensive. So there's always ways of making sure that we can communicate. Thanks, Janet. Now I want to come to Alice, because I think, you know, we've heard a lot of the challenges. So for example, going back to Mags and Ranjini's presentation, you know, with schools closed, and schools are such an obvious contact point for access and engagement with young people. I just wanted to ask you, Alice, in terms of your work at community level, how is that affecting your ability to reach the women and girls you serve?
So basically what we have done together with other youth activists across the continent is that we have done the hand washing education, but now on individual households. You know, with the social distancing and the restriction of people not together because of the virus. So we've gone to individual houses doing the training on menstrual health, and also the issue of mask and teaching people on hand washing. Together with other youth activists, we have also implemented the tipi-tapis, you know, to help, you know, different setup at the grassroots level to have hygienic measures. We have also done a lot of making the mask. And, you know, for example, in most of this country, mask is recommended. But for example, in Kenya, it is mandatory. Failure to which you are jailed for 6 months, or otherwise they charge you with $200. And you can imagine most of these families can't afford that because they live below $1 a day. And even putting food on the table is a challenge. Also with other youth activists, what we've done is making the Days for Girls reusable, washable pads that have being of so much great impact to the society and community, and especially this time because of being environmental friendly and being more sustainable to help women and girls manage menstruation. We've also gone around with our flip charts, training them at individual level, making sure we are also adhering to the government restriction. Apart from that, what we've done with other youth activists is the close partnership and collaboration with the local government and with other NGO. For example, at my social enterprise, we have worked closely with the local chief. And you know, the local chief leadership is very important because they act as a link between the local leadership and the national government. So having them on the ground, working with us during this pandemic to the household level, giving us security, you know, helping us to create awareness, making sure people have the mask, the menstrual kit, and also teaching the issue of hand washing, having them together with us. As youth activists, we feel supported in some way, you know, because we don't feel like they have left us in as much as so many challenges are in place at this moment. We have other youth activists, for example, Anita Mibe from Bomet County in Kenya, who have worked closely with the First Lady of the county, and through that she has given grant at their social enterprise for them to make masks and menstrual kits to distribute to the community. We have other youth activists in Sudan. We have seen them walk on the road, having the road show, putting the banner and poster with menstrual message out there to the community, to everybody, and also trying to help end the gender violence that is also at rise at this particular time. We have also partnered with other NGO. For example, at our social enterprise, we have worked closely with People to People Ministry, is an NGO, their regional offices based in our country. They have bought lots of masks and menstrual kits from our social enterprise, and that's also in promoting the economic empowerment for these local women and men who are working at these enterprises.
Great, thank you, Alice, and it just sounds like such fantastic work you're doing. Now, I did promise very, very early on that I was going to come back to a question that was also asked very, very early on, because I wanted to see if any of our panelists touched on it, but I don't think you did. So I actually want to go back to, maybe let's go back to Laura with this question, but you're also happy to push it back, Laura, if you want to, and we can see if any of the other panelists want to respond. So this question's from Danielle Kaiser from the Menstrual Health Hub. The question is, how can we ensure that miscarriages and other kinds of vaginal bleeding are not left out of this move towards a more unified global menstrual health agenda? So I'll go to Laura first, but also if anybody else would like to comment on this, it's open. Laura?
Thanks, Justine, and thanks, Danielle, for the question. I don't think we came across, or we specifically looked for miscarriage related to menstrual health and hygiene in our research. However, we did in our conversations, particularly with teams at the Gates Foundation, although with other experts that we spoke to, including Danielle, one of the things that came up repeatedly was that as women become, or as menstruators become more aware and have greater knowledge of menstrual health and hygiene and know their bodies better and improve their body literacy, they're more likely to recognize things that sort of aren't normal in their bodies, be it before, during, or after pregnancy. And so I think there may be a strong link between greater body literacy and then ensuring that we're not overlooking or we're not perpetuating blind spots in other key areas.
Thanks. I can take one more comment from one of the panelists if anyone else would just like to respond to this issue. No, okay. Thanks. So I promised you that if we had time, we would go to the floor and actually open up for a few comments. So I feel this is the point where it may all go wrong, so I'm a little bit wary. Anyway, if I do call out your name and I open up your mic, could I please ask you, in the interest of time, and so we can hear a number of voices, to be very, very brief in your comment or question. So please give your name, which country you're based in, and organization if you're affiliated, and then very briefly make your point and your question. So first of all, I'm going to go to Evelyn Emmanuel. Oh, you should be unmuted, Evelyn.
Yeah. Hi. My name is Evelyn from Tanzania. I'm working with Umoja Tanzania, and through Umoja Tanzania is working with the youth, empowering them through the education. I'm the leader, and I'm the one who started the enterprise at Umoja Tanzania. So our enterprise is Umoja for Girls. We are partnership with Days for Girls. I would like to take this opportunity which I have been given. The conversation has been so good and I really appreciate it, but I'm sorry I had some little challenges, just technical issues. But finally I got the point and I really like it. So what I would like to say from Tanzania as social enterprise leader or coordinator, we have been facing the challenges other people during this COVID-19. This is because we used to conduct training at different schools, but since the lockdown, even here in Tanzania, we have faced some challenges. We have no any other crowd, so we are not allowed. So we have stopped, and it has been a very challenging event to have people like 10 people at once. It has been a very challenge, but we have taken this an opportunity to make masks, which we turn over from making reusable sanitary pads, and we can reach people through giving them the mask. This is what I can say from Umoja for Girls. Thank you.
Thank you. Thank you, Evelyn, for sharing your experiences. We appreciate it. Now I'm going to go to Esenam Agyekumene, and I'm sorry if I mispronounce anybody's name, but yes, Esenemi or Esenam. Sorry.
Okay. Yeah, thank you so much for the opportunity. I'm from Ghana, and I founded the FEM Foundation Ghana, and we usually hold quarterly talks on menstrual hygiene management, menstrual health, and menstrual wellness in general. I wanted to quickly know from any of the panelists how we can drive the conversation at the workplace. Yes, so that we have more advocacy in that line as well, because I happened to work in the bank, and I had menstrual issues, and I had to resign from my job. So I'm very keen on seeing how we can drive the conversation at that angle as well. So if you can just help by giving a few details on what we can do to drive the conversation from that angle as well. Thank you.
Thanks, Esenam. And we really didn't get even into workplace dynamics today, and I saw it did come through on a couple of the questions, so really not to undervalue the importance of also recognizing the need to strengthen sort of menstrual health responsive workplaces as well, which isn't always the experience of women all over the world. That's definitely a global issue. Now I'd like to move to Micheline Kanyungwe. Micheline, you might need to unmute yourself, I think. Yeah.
Okay. So I'm a US participant from Zimbabwe, and right now I'm based in Malawi, where I'm doing my exchange. So we have been having trainings on menstrual hygiene management in schools. So because schools have been closed and the number of people that are supposed to be attending a certain gathering is limited, we are unable to conduct any trainings. I think since the first 2 weeks of March until now, we have not been able to have any trainings, and this has affected the programs, and it has affected our targets, because we were targeting to go to the southern and northern regions of Malawi so that we can conduct trainings on MHM, but then because of the COVID-19 thing, all this has it has been affected by that. Yeah, thank you.
Thanks. Thank you, Micheline. I think, many people working at community level are just feeling so frustrated that they're losing momentum in their work. But we know very much that because of the commitment of so many community organizations, that the work will regain momentum, I think, as a key part of the recovery process coming out of COVID-19. Right, I've got three more. So Amita Bhakta.
Hi there, thank you for allowing me to
Maria, can you unmute me? Please go ahead.
Hello?
Please go ahead, Amita.
Sorry. Hi there. I just wanted to complete the discussion because I've recently been doing some work on older women who are going through menopause and their menstrual hygiene needs. So women in their 40s and 50s can experience menstrual hygiene needs that are far different to those of adolescent girls. And what I've been thinking about is that during COVID-19, they would have particular issues as well. So that was the focus on schools, for example. but older women who are in their 40s can experience a lot of menstrual irregularities, so they can experience very heavy bleeding and irregular periods. So they give access to sanitary pads. That was very challenging. So I just wanted to raise awareness of the issue for older people too, and see if we get a discussion going around that. When I was in Ghana a few years ago for my research, women found that they relied on community toilets and they couldn't actually access facilities when they were closed, particularly dealing with very heavy periods. I just wanted to see if we could get that discussion going at some point. Thank you.
Thanks, Amita. And I think as a woman that falls into that particular age group, you know, I completely agree that, you know, when we talk about menstrual health, we don't think about the whole menstrual health, reproductive health journey that we go through as women, and, you know, very much focus on the needs of, you know, adolescents and younger women. But there is a huge discussion to be had. I think particularly as we start to see aging populations as well in the continent. I mean, South Africa is one country that's going to see demographic transition into a greater aging population. Is how do we really ensure that there's sufficient information and support in place for women as they move into their 40s and 50s and into menopause. So thank you so much for raising that issue. We may not have time to have the discussion today, but maybe that should be our next panel when we talk about menstrual health, because I think there's a lot of interesting things to discuss there. So I'm going to take two more comments from the floor.
Oh, sorry, I was just going to add something, but please go ahead.
I'm going to come to you for a final comment, Laura. So save it and we will get there in a second. So final comment from the floor. I'm going to go to Maria Malo. Maria, you'd need to unmute yourself if you'd like to speak.
Okay, hello.
We can hear you.
Okay, thank you very much. So I've got 3 issues that I wanted to raise. It's been a very interesting discussion, and it was very interesting to see how we are managing to work even with the reality of COVID-19. I've got 3 issues. One is the issue around leaving no one behind. So I'm coming from Angola, an organization called Mwanapo, and our first language is Portuguese. And unfortunately, I find that most Lusophone and Francophone countries are left out of the discussions because they do not speak in English. And this is very difficult for many people. It limits participation. So I think we need to start having discussions around engaging all communities and making sure that we leave no one behind. The second issue is around starting advocacy or continuing advocacy around menstrual health services or menstrual health products becoming essential products. Because from one of the presentation, I realized that one of the key issues is that they are considered as luxury. And this in the end, it limits at what level governments prioritize menstrual health services and menstrual health products. And then the last issue is around how we should build momentum at this point during for post-COVID response. For post-COVID response, in the sense that how can we use the momentum that has been created on sanitation and wash to promote menstrual health management? Yeah, so yeah, that's my question. Those are my contributions. Thank you very much.
Thanks, Maria, for those points and delivered very clearly. So we are going to run out of time, and we're actually going to get cut off when we get to well, what is 4 o'clock for me. So I do want to make sure that that doesn't happen. So what I'd like to do is following those interventions from the floor, and I'm sorry for those of you who may have had your hand raised and I didn't have a chance to come to you. I do apologize. I'm going to quickly go through all of our panelists, and I'd like your final thought, comment, call to action, whatever it might be, in a sort of 30-second soundbite. So I'm going to go first to Laura.
Great, thanks. You can tell I was eager to contribute. No, I was just thinking about Amita's comment and then Maria's comment just now. I think it's really important that as we think of leaving no one behind, we don't just focus on girls or on adolescent girls. Of course, that is a pivotal time, and that's when menstruation can be a really important vehicle to improving sexual and reproductive health and to improving body literacy. But yes, I think one of the big findings and the big aha moments for us in our research and the writing of the report was that we really need to focus on a woman's entire life cycle. How does menstruation affect her before she gets her period, after menarche, and then during menopause and afterwards? So I think that's probably what is most striking for me, and I do hope that as a field we move in that direction.
Excellent, thanks, Laura. Now I'd like to move to Ranjini.
Yes, so
We
can see me, right?
Yes, we can see you and hear you very clearly.
Okay, for my program, our aim is to develop confidence among the schoolgirls, because they don't even know. In grades 4, they start this menstruation and they don't even know from where blood is coming from. So to achieve self-esteem, you need to have that self-confidence to face all these challenges. That is the primary aim of our program, to improve their self-esteem. They should have the confidence to face the challenges, and they have to find a solution for that. So our program aims to empower these schoolgirls from primary school so they can continue to menopause. They can answer all the questions based on their challenges and whatever faces throughout their life. So that's all.
Yeah, thanks, Virginia. And I think that commitment resonates with many people we have online and what they're really trying to do through the community engagement they have running at the moment. And let's move to Janet.
Yeah, thank you. It's been so great hearing everyone's thoughts. I think very quickly for me, public participation is key. I think this is not a girls and women's issue. This is an all issue. And I think it's important that we bring in a multi-stakeholder approach to discussing issues around MHM, have the academics, the NGO, the civil society, influencer, media. That's the one way that you can really raise enough noise for everybody to be cognizant of the fact that this is really disrupting a lot of households. So it's not just women and girls. If a woman has to choose between bread and sanitary pads, that's a disruption within her home setting. And so I think that's really important. And for folks who are saying that this has obviously put a hamper in progress with regards to the communities, I think there's still an opportunity to mobilize, whether it's on a digital platform, a USSD code, to continue having this communication going. And also think about people who are differently abled or have different issues. So the other day there was a session I was having, and people came in and gave their views of menstruation and FGM, menstruation and being differently abled, menstruation while incarcerated from a former inmate. And so let's also be inclusive in our conversations and listen into everyone and think about solutions that work for different people, because it's not a one size fits all. And so that's important. And finally, even though it's not available, I have a book out called My First Time Stories, which is basically a collection of stories on people's first periods. It has sold out in the textbook stores in Kenya, which is great, because storytelling is also a very powerful tool in demystifying issues around menstruation. And we're also using this as a tool to push for policy implementation. I understand the Menstrual Health Management Bill will be launched any day now in Kenya, making it one of the first in the world. So hopefully that will change things in the country. But thank you, it was incredible seeing everyone today.
Thanks, Janet. We'll have to have you back for a reading. I can now see another panel, which is all going to be about creative expression around menstrual health. Max.
I really wanted just to highlight what Laura said, but also, during the reproductive life when women are using contraception, the menstrual cycle changes drastically. Like using IUD, you might have very heavy cycles, you might have spotting. So, all through life, the menstrual cycle changes, and you have to adapt to that. So you may not be used to having, erratic cycles, and that's something that women have to learn to live with. And I think needs a lot more counselling when they're choosing contraceptive methods, for instance. Thank you. Thank you. It's been a great webinar.
Thank you. Yasmin.
Yes, yeah, fantastic. So glad to be here. And yeah, this was amazing. I think just to echo what has been said, I mean, I think that there's an incredible opportunity for us to drive innovation that, you know, it is at this nexus of innovation and inclusion, right? Like, I think there's so many opportunities that have yet to be discovered that we could help lead and or find others that could help us build and pilot and iterate. So I think, yeah, it's exciting to see that there's so much momentum towards innovation and growth. Thanks so much, everyone.
Thank you. And Charlotte, any last thoughts from you?
Yeah, I'd like to comment on the last, on what the last participant said. I really much agree that products are not, menstrualized products are not a luxury. And I think this COVID crisis really showed that. When only essential products go through the supply chain, then we have to make the case that it's not a luxury. It's also very true for the debate we have on equity with taxation, with also integration of these products into universal health coverage. I think we really also have to push for that, because it's not the case at all at the moment. It just, advocate for everyone to understand that menstrual health products are like any other health products. And the last thing is about quality. As any other health products, they need to be, they need they need to have global standards for these products, not only for pads, but also for the cups. I think we started the discussion on this. We are working very much on the standards, both national and global, and we hope to continue in the coming months. Thanks a lot for this webinar.
Yeah, thanks, Charlotte. So I'm going to give the last word to you, Alice. You had the best backdrop. You came branded. So the last word is with you. It has to be short, sharp, and to the point.
Thank you. I feel like we should continue advocating for men involvement, men and boys, in the whole subject of menstruation. And for example, today, most of the young activists are watching this webinar as discussing this issue on menstruation. And so having some men also on the panelists would be so encouraging to promote the whole subject. Another thing is my word out there to all the youth activists. Let's continue impacting lives in the community. As Mother Teresa said, what we are doing is just like a drop in the ocean. But if that drop was not there, the ocean would not exist. So in our small way, let us continue impacting life, because we know we are making such a huge difference across the world. Thank you.
Great, thanks, Alice. That was a good way to end. So I've really enjoyed running this session today. It's been fantastic. I've also been extremely cruel, because I've only given 7 minutes left to poor Puleng and Diana that were supposed to be talking to you about innovations and doing closing remarks. So Puleng and Diana, I suggest what we do is we actually put those innovations together on a virtual place, so whether that's in an email with links, whatever it needs to be. And then I'm going to hand over to you to do closing remarks. But really just to say thank you, thank you, thank you. Thanks to our great speakers and panelists. Thanks to all of you who were online. We had almost 250 people with us today. And I wish we could have heard so many more voices. I'm not sure I ever want to be a live radio show host. This is extremely stressful, but it was a great session. So thank you so much. I won't speak again. So I'm going to hand over to Diana and Puleng to bring us to a close. Thank you.
Great. Thank you so much. Just, you know, as I've been sitting here listening to our amazing panelists and seeing all of the comments and things, I was thinking, you know, it really takes us all. We have someone from the grassroots, a youth activist, we have researchers, we have Jasmine. You know, I just think it's going to take all of these characters to help amplify this message. And COVID-19, I really like what Dr. Julietta said at the beginning, that it shined a brighter light on menstrual health. And so I think it behooves all of us in each of our sectors to rise up and to let our voices be heard and share what we're doing. I know Days for Girls as an organization was so excited to be a part of this and so grateful for all of these wonderful presenters and all of the work that everyone is doing in their corner of the world. It's taking all of us, and we're super grateful for that. I just wanted to give a shout out also to our honorary hosts who have also helped amplify this web dialogue today. So that's Honorable Soipan Tula, who is a parliament member in Kenya, WASH United Menstrual Health Hub, I'm Her, Global Menstrual Collective, Crystal Bell, and Marnie Summer. So again, it takes all of us working, and we're so grateful for everyone attending. And I'll let Pulaine close us out.
Thank you very much. Indeed, just to say thank you to everyone, thank you to our speakers, thanks to our moderator. We really greatly appreciate this, and thank you all for your comments, inputs, views, and so many more innovations that you've also shared. So please remember to share. We've shared our email addresses in the chat box so that you continue to share those innovations, because we need, or we plan to compile them into a lessons learned booklet or document that will inform our responses moving on. So this is all. We've seen that the multi-sectorality of MHM continues to be escalated and highlighted, and there's need for more based on your comments and questions, and we'll continue this conversation and indeed take advantage of what COVID has forced us to do and take it further to improve our programming and policy. Thank you so much. Thank you. Bye. And thanks to our IT colleagues. We couldn't have done this without your support.
No
Thanks,
problem.
everybody.
Thank you.